Good morning. I am once again before you. Uh, Today I would speak on geriatric medicine or geriatric healthcare. Uh, you know that the the entire world, as well as in India, the number of the population of age group 60 and above, every year it is going up and up. In India, we uh, classify or define a person if he attains age 60 plus, he is considered as a elderly person. But in many other countries, the definition are different. In some country, it is 65. But in our country, it is 60 plus. So all the persons, the crossing the age 60, they are all elderly person and they come under the senior citizen uh, group, for which government of India and different state governments have several schemes how the senior citizen of the country as well as the state are being taken care of. Those are social and an economical aspect, how those people who are elderly, considered as elderly, uh, how can they be maintained uh, in the society with dignity. But I will not speak on those area. I will mainly speak on the geriatric medicine. And geriatric medicine is nothing, is a medical science which deals with mainly the clinical preventive, uh, promotive, medical health care for people attaining 60 plus or elderly person. It includes the social aspect also, rehabilitation and psychological aspect of illness. Because we know when the age increases, it gives impact on every system of the body. Every organ of the body, uh, after reaching to a peak level, they start declining. We see the anatomy of physiology of biochemistry of function of different organs. If we analyze those things with in relation to the age, we can see that those thing, uh, like anatomy of a bone or muscle or eye or heart or intestine, everything in the decline stage, because the age gradually affects the multiplication of the cells and renewal of the cell uh, becomes sluggish, and we don't develop the muscles capacity or different organs functional ability. But most of the aging process are decided by three factors. Uh, One is uh, how physiologically or physically you are keeping yourself active. If you are very active, doing regular exercise, everything, the aging process is delayed. Nobody can stop aging process, all the changes which happen anatomically, physiologically, biochemical function. But you can delay it. There are different mechanisms how you can delay the changes which are occurring in different part of organ. Number two is disease. If you are having one or two disease or chronic disease, or you suffer repeatedly from different type of disease, maybe a communicable disease or it may be a non-communicable disease after age 60, decline process becomes rapid. So any disease occurring after age 60, the process of aging becomes faster due to that disease, after cure also. But if you are suffering from chronic diseases, the, the decline is faster than a person of age group 60 and above who doesn't have any uh, chronic disease. Similarly, the psychological factor that also decides how rapidly you are going to be a older person, and all the changes which are occurring in the body uh, can be made slower if you are psychologically, the mind, intellect is very strong. You can halt or you can reduce the process of aging in your body, and that is very important factor. If you remain happy, you enjoy yourself, you participate in different social activities, you play with your kids or you play with your pets, you spend time in garden, you participate in a spiritual activity, different progressive activity, psychologically you are active, then the aging process is delayed, and the changes which are occur in the different organ, those are delays, and accordingly the functional ability also, uh, the decline in functional ability also becomes slower. A person of age group 60 and above should carry out his normal activity, like if he's a retired, normal activity like playing with the kids, playing with the pets, doing gardening, little bit cleaning the houses, doing the uh, some cleaning of the garments, bathing, going to toilets, if required, cooking. If he can carry out all these normal activities inside home, daily activity we call, and that is a indicator. If a person's daily activity is okay, he's doing all this activity, it means that the process of aging is delayed. So we should look into this is one of the indicators. We always ask elderly person whether you are able to go to the toilet or you are able to take bath with your own without any support, whether you can walk inside your house or within the premises, or you can do a gardening, or can play, or you can participate some social activity. So those are indicator to know what is the aging process happening in its body. So the purpose, as I have told, that aging process can be delayed. It is in our hand. So as I've mentioned, how it can be delayed, that depends in several factors I have mentioned, but certain factors are genetic, and for that there are research going on, and some people they get older in a very early age group. They look all older. The decline is much faster. Some are environmental factor. Environment means in which environment you are living, not only the external environment, but internal environment, family environment. If you are living in a very good family, very joint family, or all are there, uh, they are taking care, the entire environment is good, your aging process get delayed, and certain behavioral factor also there. That comes the lifestyle. If your lifestyle is very healthy, or your aging process are delayed. And lifestyle includes your dietary habit, what type of food you are taking, how much water you are taking, how much minerals you are taking, how much vitamins you are taking, how much carbohydrate, protein, and fat you are taking, how much you are indulging yourself in your regular exercise, yoga, pranayam, meditation, and spiritual activity. So those things also is very important uh, to decide the aging process. So our purpose is healthy aging. Nobody can stop aging process, but we want that each and every older person should remain active, healthy, even though the age increases. So I would tell something about demography in India. The population of elderly person is increasing. Initially, during 1947, we had only 4 to 5% of elderly person of age group 60 plus. In last census 2011, it has gone up to 9% around, but in Odisha it is 9.25. So we are above national average. It's a good sign. If in Odisha the elder person or elderly person's ratio is higher than national average, it is a good sign that people are living for longer period here. In next years, what going to happen? Like the census 2021-22 is going on, and we expect the percentage of elderly population will go up above 13%. And by next census, say by 31, it will go up to 20%. And we are expecting by 2050, more than 25% of our population would be of age group 60 plus. It means 1/4 of our total population is going to be an older person or elderly person. So when the number is increasing very fast, it is our duty that how we can keep older person or elderly person good in health, good in uh, psychology, good in intellectually, good in uh, socially, and so that they continue to be an active contributor of this society. And it is our responsibility of not only the family, but also government has got some responsibility how the large number of population which are going to be elderly can be kept healthy. So again, elderly can be grouped into three groups. If we are 60 plus up to 75, we call it elderly. If it is more than 60, 75, it is we call old. And if it is around 90 we call very old. Is it WHO classification? So, uh, now the will decide how the other classification are there, like age-related physical decline. The number and severity of disease process an old person is classified into following nomenclature. It is mentioned here in the book that young old is called 65 to 74, and they get relieved with painkiller whenever they suffer from any pain, and they get relieved. Old and old, that is 75 and above up to 60, 84 year, doesn't get any degree of relief with painkiller. Oldest old, when the person becomes 85 plus, medicine doesn't give any relief to that person as regards to pain. This is a different type of classification. So, as I've mentioned, the actual aging, the rule of three. 1/3 of the functional decline is due to actual aging. You cannot stop. Another 1/3 is attributed to the disease. As I mentioned, if there is any disease happening in elderly person, there is fast decline. So you should, or elderly person should be protected from suffering from any disease. It may be diarrhea, it may be malaria, it may be TB, or it may be cancer, it may be diabetes, any disease. Because disease, either chronic or acute, the decline process or aging process become faster. Another thing is disuse. Disuse of your or non-use of your mental ability or physical ability. If you are not utilizing or if you are not doing any exercise, you are not doing any mental exercise or physical exercise, your aging process becomes faster. So, what happens? Let us discuss anatomy, physiology, biochemistry, and functional ability of aging people. If we come from head to toe, in the mind or in the brain, the total volume of the brain neuron cell reduces. The neurotransmission inside the brain also delayed or reduces. There are several neural hormone which are being secreted in the body, and they work as a neurotransmission, and those helps in transmission or between the neuron to neuron in the brain. And because of decrease in neurotransmission, decrease in volume of neuron, the person start forgetting. The memory power are lost, and we call this condition a dementia. Another important, very important, which is more a social, environmental factor, is depression. Most of the older person, they suffer from depression. Maybe various reasons. Maybe disease is causing depression. Maybe environment is causing depression. You cannot taste food, or he doesn't have appetite. His digestion is not good. So his sleep is not good. So he becomes depressive. So depression, these are the very anxiety. They are very anxiety because in a very small thing they get lot of anxiety, and they don't have sound sleep in the night. So these are the mental, and subsequently they suffer from many other mental related diseases. if those are not taken care of early. Then coming to the eye, most of the older person of age group 60 and plus, they suffer from cataract. Here what happens, the lens becomes opaque. The light which is being transmitted from outside inside our eyes falls in the retina. The image is formed through which we see the the cornea, the upper part, transparent part, and the lens. And the lens, there are degenerative changes happens, and gradually the lens becomes hazier, hazier, and hazier, and they are not able to uh, the light cannot go inside and is obstructed at the lens level. So that condition is known as cataract. But in our country, 80% blindness or blind people are due to cataract. And all these 80% blind person can regain their vision through cataract operation. If we can remove that lens, put the glass from outside or from inside, a person is able to see. And that is the biggest disability we see in India. So we should have very good plan that all the cataract persons in the society should be operated. All the new cataract persons which are occurring every year should not wait more than 1 or 2 years, get operated, so that at least 80% of blindness problem can be solved in our state. Then comes to the ear. In ear, the hearing is lost, loss of hearing, deafness is produced, because in the middle ear there are 3 bones, small bones. Those bones get fused and cannot transmit the sound wave properly to the internal drum, and patient cannot hear. The loss of hearing occurs. And again, is if around 40 or 50% of older person, they suffer from deafness. And again, this can also be treated if we can provide them external uh, hearing aids. I think they can. And if a person cannot hear properly, it develops mental problem, it develops depression, it develops always anxiety. So then that affects other part of the body. So hearing is a very important. As soon as possible, the older person should be provided hearing aid. Then coming to the oral cavity and nose. In oral cavity, we are having taste buds, and there are glands which secretes the saliva. In the nose, we have got olfactory nerve. There are sensory nerve which help in smell. So, what happens in the older person? The number of taste bud reduces. Number of sensory or the olfactory nerves ending get sluggish. They cannot smell. They cannot feel the taste of the food. Most of the elderly person, they also lose their teeth. Saliva secretion is reduced. So what happens? They don't get any pleasure of any food, and gradually they lose the interest on food, and they usually take less food. And because as saliva also helps in digestion, they suffer from digestion problem. As teeth is also help in crushing the food in the smaller portion, that cannot happen, and they immediately swallow those food. So they suffer from indigestion and abdominal pain. That is very important uh, thing which are being overlooked. Then I have also mentioned the saliva help in digestion. Then the food pipe, the esophagus. The esophagus is a pipe which carry the food from mouth to the stomach. And usually what happens, where it joins with stomach, there is a sphincter. And that sphincter get loosened in older person. And most of the older person, they suffer from GERD or gastroesophageal reflux disease, because acid that comes to the esophageal area because sphincter is not tight, and patients suffer from heartburn and acidity. And if the acid goes to the lungs, they repeatedly suffer from pneumonia, aspiration pneumonia, and chronic pulmonary fibrosis. So GERD should be taken care of, and what food they should take, in what interval they should take, what exercise they should do so that acid will not come to the esophagus. Those are there. There are practices or yoga or how we can reduce the GERD in older person. The quality of food, less of fried thing, less of oily thing, mostly the boiled item, less of starchy food. So those are the things which I will tell later on. So that is very important. Then as in stomach, the food goes, because there is decline in the epithelial lining cell which helps in digestion. There is decline in enzyme secretion from liver, which comes through bile and all. Decline in pancreatic enzymes, which helps in digestion. So total decline. So that affects in digestion. Patient or the person suffer from indigestion, flatulence, and it create problem and loss of appetite. That is very important thing. Then intestine, in an intestine, again the breast border get diminished and the peristaltic movement get reduced. The person suffer from constipation. If food is not good, if doesn't contain more fibers, and if he doesn't take proper fluid or water, the constipation create flatulence, indigestion, and also less of appetite. And if bowel habit is not good, it may create problem for development of colorectal cancer. So, and sometimes if breast border is not proper, all the natural vitamins which were been manufactured in the intestine gut, those are not been formed, and patients suffer from repeated diarrhea, because not only the constipation is a problem, but sometimes the person of elderly age group, they suffer from repeated diarrhea, where the minerals have been lost, breast border is lost, and patients suffer from the deficiency of vitamins and minerals. Liver gets sunken, all the enzymes which are being secreted by the liver, they are being reduced. Kidney total number of glomeruli are reduced, tubules are shortened, the total excretion and secretion and absorption becomes less, the urea creatine value increases, less urine output, and older person very often suffer from sodium potassium imbalance that gives rise to delirium like symptom, drowsiness, and those have been wrongly taken as a mental problem or mental illness, but the problem is in sodium and potassium value of the blood, and that's happened mostly because of kidney problem. So those are to be taken care of. Then another important thing is the upper respiratory tract, because in the larynx and pharynx or say trachea, there is again the dryness happens. The elderly person more prone to get infection. In lower respiratory tract, again the cilia bottle which uh, excrete out all the secretion that is not happen. There is accumulation of sputum in the lungs. Patient cannot breathe properly. There is dyspnea, breathlessness. There are interstitial problems, fibrosis, and the total oxygen saturation come down. And the elderly person usually they cough very often, and because they cough very often, they cannot expel out the mucus secretion which is happening in the total respiratory system. So we have to do like lot of respiratory exercises, physiotherapy, so that more of water intake, so that those cough or secretion which are being, those can be expelled out properly. So this is the problem which happens in the lungs also. Muscles, total volume of muscle is reduced. Patient everywhere, wherever the muscle is there, the volume, the myocyte is being converted into fibrocytes, and the total volume is reduced, and that is the reason why they lost weight. They cannot do uh, the work properly, and because of loss in myocyte and total volume of the muscles, they cannot properly walk. The imbalance occurs, and they can fall. They can develop fracture of bone because of fall, and that is very important. On those can be also be taken care of with proper massage and proper food intake. We can delay the process of muscular decline. Similarly, muscles uh, of respiratory tract and heart, the heart muscles also get reduced. There are more fibrocyte, dilatation of heart occurs. The cardiomyopathy develop. The ejection factor reduce. Patient cannot pump out the blood properly to the system. The valve gets shrunken, and there is the communication between the ventricles and atrium, the chambers, those are disturbed, and ultimately patient develop cardiomyopathy, enlarged heart, dyspnea, right ventricular failure, more fluid in the lungs, respiratory system, pulmonary edema, dyspnea leads to pulmonary hypertension, and ultimately ascites. And so these are the chronic problem. One after these are all physiological problems which can be taken care of. We can prevent all those things. Doesn't mean that we cannot prevent. These are preventable things. These are preventable things. So bone, very important. The calcium absorption and assimilation reduced in older person. You know, the bone are mostly made of calcium and phosphorus, and so when in older person, because calcium is not being absorbed, there is deficiency in vitamin D which help in assimilation of calcium, and there is not proper deposit of calcium in the bone, and bone gets porous, and those bones are very prone for fracture. A little injury or a tendon jerk can cause a fracture, and those are known as physiological fracture, and which are very common in elderly person, and usually the fracture can be anywhere. Mostly they suffer from neck of the femur fracture, spine fracture, femur fracture, even small bone get fracture. So that is a major medical problem in elderly person. And again, this is preventable. We can prevent by doing proper exercise, giving them proper calcium, vitamin D, sunlight exposure, giving them support. They should not fall. We should prevent our elderly person from fall. Any fall may cause problem. There is a study done in the UK. If an older person get trochanteric fracture, is very common in the older person. It's a physiological fracture. The life expectancy reduces by 10 years. Suppose he is going to survive another 10 years, and if he suffer from trochanteric fracture and that fracture is not been taken care of, unless there is replacement of a joint, we treat conservatively, then the chances of survival is reduced by 10 years. So this has been experimented, and study has been done. People suffer from joint problem, osteoarthritic changes, degenerative changes, pain in joint. They cannot walk, they cannot go anywhere. They remain confined to their bed, and that is a major problem, particularly in the obese person. Those skin becomes dry, wrinkling becomes because of less of sweating and oil, subcutaneous fat is reduced, skin becomes very prone for any infection or injury. And ulcer, nerve, I've already told the total neuron gets sunken, reduced, neural transmission is reduced. The person or elderly person more suffer from peripheral neural problem like we call lower motor problem, bilateral symmetrical tingling of sensation, burning of hand, feet, small job they cannot do, they cannot hold a small objective, the disfigurement of the joint, and totally hand capacity is reduced. So that happens in the foot also. The peripheral nerve are morely affected. Kidney, I have already told. Bladder, because of loss of involuntary muscles control over the bladder. The incontinency is a very important finding in the elder person. People goes to toilet repeatedly, they cannot hold the urine because the sphincter is loosened. Prostate is another problem. When prostate get initially they suffer from dysuria, then lack of urination, repeated urination, small volume urination, retention of urine in the bladder, and sometimes the patient suffer from anemia. They cannot pass the hair becomes grey. So all the from top to bottom, the elderly person face this problem because of. But whatever I have told, these are all preventable things. We can prevent each and every anatomical, physiological, biochemical, and functional decline. Those things I will cover in the next talk. Taking individual organ and how a healthy or elderly person can live healthier for more years and can contribute in social development and social activity. As I have told, the number of older person increasing, it is the responsibility of society and government to preserve old people, give them support, give them economical support, because we know that 80% of total income of elderly person which they get from pension, hardly 15% of 10% people get pension, 90% people they don't get any pension. They are been provided old age pension by welfare, but those are very small. And if they have got any chronic disease, though government is providing free treatment, but still the out-of-pocket expenditure is very high, and that goes around 80% of their total pensionary income goes for treatment. In the rural area, most of the older peoples are living alone without their children, and nobody to take care of. Here the responsibility of society comes. We have to see them, and there should be special program lunch for home-based palliative care and supportive care by the government, so that those people who cannot come to the hospital or nearest health center can be provided health services at their home. Government should keep a total database of elderly person and disease profile, so that elderly person can be taken care of at the time of need by providing home-based care. So, in coming years, we are going to face more and more geriatric health problem, and we should be ready. Our system should be ready. Thank you very much. Thank you very much.